This video will provide a better understanding of how to treat a patient with major depressive disorder. The first step in managing a patient with major depressive disorder is understanding some things outside the office that can contribute to their overall oral health. First, the patient could have neglected oral health. A lot of the time, patients with major depressive disorder lack the motivation or energy to take care of their teeth, let alone themselves in general. These patients could also end up with a poor diet, which can be undereating or overeating. The patient could also crave high sugar food, which can lead to caries. Some specific drugs taken with major depressive disorder are sertraline, and a significant side effect is xerostomia. Xerostomia is a condition characterized by dry mouth, which can also lead to caries. Bruxism occurs when a patient grinds or clenches their teeth excessively. This can lead to the breakdown of enamel and increase the likelihood of caries developing. Patients with major depressive disorder can also have generalized anxiety disorder. You can notice symptoms of this by their vitals. Do they have an increased heart rate? Also, the patients could feel embarrassed or ashamed due to knowing they have neglected their oral health.
Next, we have management considerations, assessment, and communication. It is important to make sure we have an update current medical history and medications being used, and that we thoroughly understand the patient's condition, the side effects of the medications they are taking, and the symptoms they are experiencing, as it can help us better plan treatment and interventions necessary. For the intraoral and extraoral exam, the first thing that we want to pay attention to is xerostomia or dry mouth, as it is a common side effect of many medications that they are taking. Second of all, it is important to establish trust with the patient. Establishing trust with the patient will help them feel comfortable while they are in the chair and open up to us as a dental hygienist, so we can better understand what they are feeling and how that we can better help with those emotions, or how we can get them referral for a help. Secondly, we want to plan appointments early in the morning and early in the week. Planning appointments early in the morning and early in the week is essential, as it can help reduce their anxiety and stress, so they're not worried about the appointment all week long. Next is the consistency of hygienist. It may be beneficial to have these patients see the same hygienist at each appointment, as seeing the same hygienist reduces the anxiety that they see about sharing their experience with multiple people. As someone with major depressive disorder, sometimes they are uncomfortable sharing and opening up to patients or opening up to clinicians. So keeping the same hygienist is essential.
Next on oral health education. This is the most important part of the appointment. For biofilm control, we aim to provide clear and straightforward instructions. This includes brushing twice a day and with a toothpaste containing fluoride and flossing once a day. Mouthwash containing fluoride can also be suggested by swishing once a day. To better motivate this patient, we can recommend that they brush their teeth after eating breakfast in the mornings to help establish a routine, or suggest setting reminders on their phone. Again, at every appointment, it's essential to give them small praises on how they are doing with their oral hygiene. If the patient has xerostomia, the best ways to help alleviate this condition are by drinking more water, chewing sugar-free gum, which stimulates saliva production while also decreasing the chances of cavities, and avoiding alcohol and coffee, as these can exacerbate the dryness. When it comes to diet, it is essential to limit high sugar foods and drinks and increase the intake of high nutrient foods such as vegetables, fruits, and whole grains.
So that is the end of our presentation on patients with major depressive disorder, and hopefully by this, you can better understand what to expect when seeking a patient with major depressive disorder, as it is a common condition that many experience. So as a dental hygienist, you are probably more than likely going to see a patient with major depressive disorder at some point. So hopefully this was very beneficial. Thank you.
Thank you.